Hello and welcome to today's webinar. Firstly, thank you to everyone here. I guess firstly, my name is Nathan Sharp. I am today's host and I'm going to be the facilitator for the conversation with TestCard. I'll allow each person to introduce themselves, but to my left, I've got Dr. Andrew Botham, who is the Chief Scientific Officer and the founder of TestCard. I've got Catherine Hurst, who is the Chief Product Officer. And joining us, we've got Dr. Rahul Batra, who is the Clinical Innovations and Disruptive Technologies Lead in the Center for Clinical Infection and Diagnostic Research at Guy's and St. Thomas's Hospital. Thank you for all three of you for joining us today. I really appreciate you taking time out of your day and obviously to come and talk about how TestCard's story, where you guys are at in your journey, how you're currently taking it to market, and Dr. Rahul, how that has fed into your partnership as well, and how closely you've been working with the team. I guess to start, Andrew, it makes sense to start with yourself, given your kind of obviously deep understanding of the TestCard journey and where it all started. Do you mind just introducing yourself again and where it all started?
No problem. So I'm Andrew. I'm the Chief Scientific Officer and one of the founders of TestCard. TestCard started quite some in 2017, where me and my co-founder, we had a conversation over dinner about how bad men were, especially at engaging in healthcare. Men are awful at it. Women are much, much better at doing the things they're supposed to do. And it became a bigger conversation about healthcare accessibility and how people can become isolated from healthcare. We eventually developed a product, which was a postcard-based product, along with a mobile phone application that allowed people to diagnose common conditions in the comfort, convenience, and privacy of their own home. Then the pandemic hit. COVID obviously made a lot of things difficult for a lot of people. It did, however, highlight some of the things we've been saying for years, that we needed to improve access to healthcare and access to diagnostics and access to data in order to support both individuals but also healthcare services. It was during that time that we had an introduction to a manufacturer of diagnostic tests in the UK called SureScreen, who were one of the primary producers of COVID testing.
Yeah.
And then on from that introduction with Rahul within Guy's and St. Thomas's. And together we designed a tool that allowed us to better deliver and implement testing within a clinical environment, for supportiveness for clinical staff, supportiveness for patients, but also the instant availability of data to allow them to manage conditions quickly and respond to any changes that they needed to do.
Okay, fantastic. No, thank you for that. And I think it's quite a high level overview there. I mean, do you mind just going into a little bit more, I guess, about maybe your background and then how that feeds into the technology and why that was the way you chose to go?
So when TestCard was founded, at the time I was running a blood sciences service for an NHS trust. So we had a number of laboratories. I was running a number of clinical laboratory services for testing. And my co-founder, Luke Heron, had a background in consumer apps, direct-to-consumer apps. And the idea sort of grew out of that. Now, my background in laboratory testing, and I had a deep understanding about where problems can occur. Things with laboratories, they're very tightly controlled environments. You've got tens of millions of pounds worth of equipment in there. But the biggest driver of the integrity of the result was actually what happened to the sample before it ever arrived at the laboratory, is whether it was taken from the right person, whether it was labeled correctly, whether it was transported correctly, whether it's in the correct sample vial. All of these different pre-analytical variables and human factors and mistakes that can be made. So when we were designing TestCard and TestCard services such as ClearScreen, we built those elements into it effectively to remove the number of those different errors and mistakes that can occur.
Okay. No, thank you for that. And you mentioned then SureScreen.
That's right. Yeah.
Talk us a little bit through about that collaboration, that partnership, and where that came from.
It's another sort of, in the same way that was a conversation with my co-founders to start TestCard. It was a fairly simple conversation with David Campbell, one of the directors of SureScreen. I literally phoned up the sales line and said, look, you're producing COVID tests. We think we have a product that will, together we can be more than the sum of our parts. You've got a good test. We've got good technology. Together we can actually create something that's going to be that much more powerful and supportive for health systems and for patients.
Yeah.
And it just grew from there.
Perfect. No, thank you. Um, Dr. Rahul, I will come to yourself now. Thank you for joining us and taking time out of your busy day.
Sure. Thank you for having me.
No worries. Do you want to just introduce yourself and I guess your role and I guess how
Sure.
how that fits in with TestCard as well?
Sure. So I'm Rahul Batra. I'm an infectious diseases physician at Guy's and St. Thomas's. I have a specific role and remit in developing new technologies and implementing rapid diagnostics, essentially, for our department and for the hospital. So how did we get involved in TestCard and SureScreen?
Mm-hmm.
So I think early in the pandemic, we quickly realized that mass testing was going to be necessary. I think both in the hospital and in the wider community. We felt that because we didn't have the lab capacity to deal with the amount of testing that was really necessary to deal with the pandemic. So I think it was very early in the pandemic, in March of 2020, we actually reached out to David Campbell at SureScreen and said, look, we think, lateral flow testing is going to be the future of how we manage the pandemic. And, if there's products that you have available, we'd like to partner with you and help you develop those for both inpatient and community use. And so we quickly went down the path of developing first an antibody test, which was fairly successful. And we used early in the pandemic phase to look at post-infectious immune responses and the post-infectious immune syndrome that was happening late in the course of a patient. But we quickly then moved on to developing an antigen test. That was about the summer of 2020. So that was our first kind of foray into getting involved in the lateral flow testing. But it was pretty quick to realize that we also needed a digital solution in order for us to robustly record the information that we were collecting through the test and also then provide those results directly to the clinician in real time, essentially. And I think that's where we then started our journey with TestCard.
Okay. You mentioned there obviously looking for that digital solution, which is a part I picked up on and I think is obviously a key part of the partnership with TestCard here. Talk us a little bit, well, talk me through like the idea for that. Where did it come from and why was that so needed? Especially at the time you were in, especially around the start of the pandemic and how that fit in very neatly with that as well.
Sure. So lateral flow testing has been around for a long time. I think one of the reasons it hasn't been widely implemented is the robust capture of information and the availability of results. And so I think what we found in the hospital was that we needed to do the tests immediately, but then have those tests reported in the patient record where they were accessible to all clinicians. And that required some type of digital capture technology. We also wanted to standardize the reading so that we didn't have reader-to-reader variability, which is what we were seeing early on with manual reading and recording. So again, we started to come back to the fact that more and more, in order to implement this in an inpatient setting, we really needed a way of digitally capturing the result, being able to report that result in the patient record, and to actually store a picture of that result for review later on if there was discrepancies.
Yeah, I think there's the lateral flow test. There's a lot of good things about lateral flow tests. They're relatively low cost. They are, they're rapid. They're giving you results very, very quickly, and they're giving you results at the point, in the place that you need that result. They're also really easy to scale because there's no equipment generally required for them, so they can be spread out very, very widely in multiple different areas. There's not much infrastructure required for them, but they're probably get in trouble for saying things like this are universally poorly delivered in many cases because of the issues that Raul's talking about there. There's no standardization in testing. You've got no control over how people are performing it. You don't know if they're doing it right. You don't have any means of capturing patient information. You don't have any ways of capturing the results. So you're relying on people writing down the result and then transferring it into it. So it's very manual, administratively heavy. So by linking the digital solutions together, we have 100% patient identification because we can scan their ID. So there's no patient mix-ups. There's standardization of reading, which means there's always the same person reading it, which is the camera in the phone.
Yep.
So there isn't any sort of subjectivity. It's not about what you think it is or what I think it is. It's always the same reader. There's a piece of raw data captured. You actually have a picture of the cassette, which is something you know, once you've done the test, it disappears. You have nothing to refer back to know if that's correct.
Yep.
You've got good clinical traceability because we can trace the lot number and expiry dates of the kits to make sure the correct ones were used. And then if there's any problems later on, those can be removed. We've got direct transfer into the patient record. So there's no chances that anyone's going to type the wrong result in, you know, there's no transcription error issues. But I think one of the things that we didn't expect necessarily was the improvement in the quality of the results that we were getting out from lateral flow.
Okay.
You know, it was generally accepted that PCR was the best way of testing for COVID and lateral flows were its poor cousins.
Yeah.
You know, the quality of the results were much, much lower. But what we saw when it was delivered into GSTT over time is an improvement in the quality of the lateral flow results. So what was happening were, you know, when every time there was a discrepancy, because Raul and his team had a way of going back to the lateral flow raw data saying this is what the test looked like, we know who did it and we know where they were, we know how it was done, that we had this reciprocal relationship with the users. So we could always go back and rather than just saying this is how you do the test, we were able to say this is why you have to do it this way. So it wasn't a training issue, it was an understanding as to the importance of leaving it for the full 10 minutes, for example, for the tester. Because we could say, look, you missed a COVID patient, a COVID infection, which if you'd done it correctly, you would have picked it up. And over time, the lateral flow results and the PCR results come close together to the point where Raul's team actually stopped using PCR and moved over to lateral flow entirely.
Sorry, go ahead, Raul.
We were able to really decrease our reliance on PCR and given the speed and the way that we were able to deploy the test near the patient, we actually were able to speed up our patient transfers, keep our A&E open, and now we've moved the test throughout the hospital. And so, you know, at the height of COVID, we were doing between 15 and 17,000 tests a month, which is a phenomenal amount of testing. Our capture was, you know, upwards of 90% using the digital application, and so is really revolutionized the way that we have deployed these tests and the way that we look at some of these more economical technologies.
Thank you very much. I mean, there's a few questions that are going through my head, and one of them I'll come back to you in a minute. I do just want to say if anybody listening and watching on the Zoom or on LinkedIn Live does have any questions at the end of the conversation, we will come to those questions and try and get them answered if we have some time. So please pop them in the Zoom chat or in the LinkedIn Live, and we will try to get to them at the end. What was going through my mind in while you were speaking, Andrew, and Dr. Rahul, while you were speaking, was there had to be a lot of collaboration between, I guess, the two companies here, where you started from when you first obviously started using the technology, and then where you've ended up to now, where you rolled it out, and you mentioned rolling it out across the hospital. Talk me through where it started and where you guys have got to now, how you started rolling it out internally, Dr. Rahul, if you would.
Sure. So I think early when we were deciding who our partners should be for development of these tests and the digital applications, I think one of the things that we focused on were dealing directly with the manufacturers and the providers of the tests and the applications, and with partners that would allow us to, you know, work in very close collaboration, who had manufacturing and bases here in the UK, given some of the challenges during the pandemic around workflows and supply chains. So it was really important for us to partner with SureScreen and TestCard, because it allowed us to make iterative changes. As the needs and the pandemic changed, we were able to change with it, and adjust our technologies and our tests to meet those challenges.
No, fantastic. Thank you for that. It was just I wanted to, I guess, understand how it had been done. And look, obviously, then you got to this stage, and I think, Catherine, this is probably where it's a good point for you to introduce yourself and the part you play in the TestCard journey and your role here.
Yeah, I'm Kat Hurst. I'm the Chief Product Officer at TestCard, and I actually joined TestCard in January 2021. So it was shortly after this discussion had started, this sort of three-way partnership had started with TestCard and SureScreen and Guys. And I was very lucky that the minute I walked in the door, they were like, "Hey, do you want to look after this project?" I said, "Yes, I would actually." And we have been throughout incredibly fortunate to have Rahul and the team down at Guys and St. Thomas's as partners in this endeavor, because designing tech and developing tech like this, it's not really about the tech in isolation. I mean, it's about designing a user experience for real people in a real situation. So, of course, we need to make the tech work, and our tech is complex. So we're starting with a fairly high degree of difficulty, but it goes, it really goes beyond that tech solution. How do we make it work with their current workflows, right? So looking for opportunities to use things that they have in place already. We want it to feel like a step change improvement for them, but we don't want it to feel like we're blowing their heads off. It can't be so different that it's, a shock to the system. But with improvements that they can feel, in their daily work, and easy for that particular group, right? There's no universal rules about what makes a piece of software easy to use. No. It's about what makes it easy for this group to incorporate into their work. So again, we were very direct sometimes feedback from that group. And so it was an iterative journey, really. And we reduced friction through iteration. So we were able to really have insight into their processes so that we could think about how we can reduce errors. How can we make it hard for them to make an error in the software? And how do we make it blatantly obvious what they need to do on every screen? Because these nurses and other healthcare professionals literally don't have a minute to spare. No. They cannot faff around with technology. It has to be pick it up and use it first time, the right time, every time. Yeah. And so, what can make their jobs easier, but also what's best for the patients, right? And what's best for the staff that need to deploy the solution into the hospital. So there are a lot of stakeholders that we're thinking about as we're designing and developing and iterating products. This is going to sound overly sincere, but I'm American, so I can get away with it, right? Like what the clinical professionals did for us through the pandemic, right? And what they still do for us every day. When I design products that are going to be used in the NHS, it's like my little thank you back to them, right? Yeah. Like, how do I make this easy for you and make your life a little bit easier? And I know my team feels the same way and are really passionate about the fact they're so excited when we get news back from the hospital, or that it's in use. Or this past year when we launched the combined COVID and flu test, which is another SureScreen product, we knew that it was going to be in use for throughout the winter in A&E. And if you think about the impact of a product like that, right? So you have someone come in with respiratory symptoms, right? That's what you have all winter long, right? Yeah. So within 10 minutes, as they walk in the door, you can test them and have a test result for both COVID and flu A and B. So you immediately know what they have. These are infectious diseases. You can cohort people appropriately. That means everyone is safer. Other patients, guests in the hospital, staff, staff sickness is such an issue in the winter season. So, so that they can safely bring people into the groups, and obviously clinical intervention faster. So, So, you know, using systems they had in place, they have barcoding already for user IDs, for patient IDs, test request IDs. There was no reason for us to reinvent the wheel.
Yep.
I think one of the things that was really key was looking at IT.
Yep.
And how we were going to get our product, the results, test results, and other data through to the electronic health record, because IT teams in the NHS historically just don't have any time to spare.
Yeah.
And also they're quite naturally a bit nervous about people touching their core systems. So there was existing middleware in place that we were lucky enough to be able to exploit. So we have a one-way, a unidirectional flow of data.
Mm-hmm.
That means we pull nothing down from the patient record. There are no issues with data security, information security. We don't store any information on patient data on the phones.
Mm-hmm.
So if a patient or anybody just walked out with one, in the emergency department, there's no patient data stored there, and it's incredibly cost effective to launch a product on a mobile phone.
Yeah.
If you think about a fixed terminal machine in a hospital that could cost tens of thousands of pounds, and they're running on some Samsung phones down there, cost about 150 quid each. So it's a low cost implementation, pretty painless compared to implementing other things that need to talk to the health record. So.
Yeah. By the way, you mentioned your passion there, and like I think it's very clear. And your analogy about giving something back and working with your team and TestCard to be able to do that is unique, I think, and you can definitely hear that when you were speaking through it, for sure. I mean, talk to me about a little bit about, I guess, the commercialization and where you guys are at, and maybe why that was tough for you guys to start with when you joined the business, and where that's kind of led to you now.
Well, I mean, I think people maybe who haven't had this journey of working with the NHS tend to think of the NHS as just one thing. And it's not. The NHS is not a single entity. It doesn't exist. So finding the right people to talk to and put the solution in front of, that's why opportunities like this are great. Thanks everybody for joining. And if you want to understand the commercials further, or you want to talk about how ClearScreen can work in your clinical organization, please get in touch. But no, we're a small business, right? And visibility is tough. It can be about, just getting in front of that, getting to meet that right person through networking. And Andrew's our absolute guru who goes out and talks to everybody, and he's incredibly inspiring because he feels the same way that I do about the opportunity to work with the health system. This is something we deeply care about and believe in. So the solutions need to be cost effective, as I mentioned. It needs to be, it needs to address maybe more than just the one problem that it's solving. So for example, if we're doing point of care rapid diagnostic testing, one of the other things it might be addressing for an individual trust is that they have a paperless, a digitizing initiative that they are trying to achieve. And that's not easy, especially in places like emergency departments and other like fast clinical care environments. Really hard to go paperless. So if you start making a multifunctional tool that allows them to digitize more than one thing, suddenly that becomes valuable for them in a different way. So it's about finding and exploiting those needs, and making sure that we are making a product that, again, because we were so lucky to work directly with the NHS, we know it's fit for purpose. It's plug and play for any NHS trust in the country.
No.
I think a key thing for us has been Raoul through the whole journey.
100%.
And coming from background where I've tried to do, or I've worked a lot in innovations, both within the NHS and from the outside, trying to work in to drive innovations. No one's sitting around in the NHS going, what should I do with my time right now? No. Everyone is working at full capacity, or they're always working at full tilt. So it's really hard for them to find the time to do the things that are going to save them time, and to do these sort of improvements and do these sort of changes. And, because they're just constantly, their priority is the patient in front of them. And that's absolutely what should be happening. That should absolutely be their priority. But that does pull them away sometimes from being able to see, into the future in terms of how things are going. And, around 50% of the staff within the NHS are clinical staff, so doctors and nurses. But there are so many people behind the scenes that basically create these systems, such as the IT people, that enable them to then have the tools they need to do it. And, I was very passionate even in the NHS about what laboratories and what testing can do, because when it comes to a doctor can be in front of a patient and save their life. And, but even within their entire career, the number of people they can see is limited by the amount of time they have. Where when it comes to these sort of digital solutions, if we can do this right, we only need to make a saving of a minute or two per patient. That's it, a saving of just a few minutes per patient in terms of making things a little bit easier, a little bit faster, a little bit simpler, more scalable, more accessible. And that perpetuates through the system to a huge extent. And that will save thousands of lives over the course of a year. And no one will ever know it. No one will ever know that it's happened. It will never show up on any balance sheet. But what it will do is it just makes things that much easier, so people aren't waiting in emergency rooms, so that clinical staff have more time to spend with the difficult cases, the cases that are going to need their attention more. Data genuinely saves lives, and the correct implementation of these clinical tools makes a huge difference.
And you need an advocate. And we were so lucky to have one in Rahul who gets that and is, and is willing to get behind and shove. And like the motivation there is incredible. So it's awesome.
And that's what I was going to come back to here, because I think that's obviously testament to yourself, Dr. Rahul, and your team. I can't imagine that the process to start working with TestCard was too easy from maybe TestCard side or your side, or you maybe want to drive that initiative, but actually getting that off the ground. Do you mind just talking me through, I guess, A, how that started, but then also B, the impact that this technology has had within the clinical setting?
Sure. And just as Andrew and Kat both said, this is a true partnership. We have been very lucky to work with TestCard and SureScreen, both very responsive to our needs. And there was a lot of mission creep going on during the pandemic. So I'm sure Kat will tell you that every 2 to 3 days there was a new ask, a new product, a new change that needed to be worked on immediately. So it's
very straightforward.
It's a two-way street when it comes to the needs of the NHS and the needs of and what can be provided by your collaborators and partners. So implementing anything in the NHS it can be incredibly difficult. Implementing IT solutions can be even more difficult, and then trying to implement an IT solution on a mobile platform using new diagnostic technology is very, very difficult. I can't take all the credit here. The pandemic did drive a lot of this. It gave us a lot of resource. It gave us a little bit of freedom to act. So we did have some support on that side. I think the thing to understand is that you have to understand your need and how your collaborators and the new technologies can meet or exceed those needs. Our need was mass testing and fast testing. And just to give you an example of what Andrew was saying, when we were doing our early evaluations of a 10-minute test like SureScreen versus a 15 or 20-minute test that some of the other lateral flow providers had, that 5 minutes made a huge difference in the flow of patients through A&E, almost to the point that A&E would grind to a halt if you had to wait 15 minutes for a test result. So even those small minutes that you save, making the reader technology so quick that it's as fast as checking off boxes on a piece of paper, which was essentially the remit that the grand challenge that we put in front of TestCard was, hey, you've got to make this faster, quicker, and better than a nurse checking off 3 boxes on a piece of paper and sticking it on the front of the chart. So if you can do that, then we're good to go. If you can't do that, then this is all going to fall apart within the first 10 minutes of going live in A&E. So, those are the types of things that you have to do in order to convince the people that need convincing that you can get a new technology into the clinical space, especially when the first clinical space you're trying to access is A&E, which is incredibly difficult and busy. So yeah, so I think it's a testament to them meeting the challenge and us being able to put forward a coherent plan on how we can improve our patient outcomes and patient flow through the hospital during the pandemic.
Talk me through the potential, Dr. Rahul, for TestCard's product here, because I can see exactly where it's been working, the partnership so far, but talk to me about where it can be used in other areas of the hospital, because I have no doubt it can, and where that can expand into.
Sure. So we currently use this digital solution for COVID in many parts of the hospital. Not in every part, but in most parts of the hospital have access to using this for COVID. A&E, we've already in the first year gone from COVID to a dual cassette. So we're doing COVID and flu. There's plenty of infectious diseases remit here. So we're looking at hepatitis, Hep B and C with universal screening as part of an NHS mandate. We also developed a test for monkeypox and strep A during the periods of those outbreaks. They came and went fairly quickly, but the technology allowed us to quickly pivot to putting those types of tests into place in areas outside of A&E, so in our sexual health clinics, because you have a digital solution and a mobile platform, you can pretty much pick it up, lift it, and take it wherever you need to go. Our next big push is outside of the infectious diseases space. So we're looking at things like digitizing the pregnancy tests that we do in A&E now that we're becoming paperless. Typically, pregnancy tests are just kind of done and then scribbled somewhere in the notes or on a piece of paper. Usually repeated again at some point. So this offers us the potential to capture that result and then not have to repeat it as the patient moves throughout the hospital in their patient journey. We are also hoping that we can also push out to our community. So home testing, giving access to patients at home to do testing and provide immediate results to their clinicians to make decisions, I think is an area that we are actively pursuing with this type of technology.
Perfect. And I think, like you say, it's overall about, therefore it improves that whole patient kind of journey and the outcome as well. And then storing that data then brings that full cycle as well, which is obviously what we're trying to improve here. So go ahead.
Yeah, so I think Raul touched on a couple of other things as well, in terms of it's not just about a result, it's about that transmissibility of that result. So during COVID, it was they were doing the testing in emergency room, but then they needed that to see that result by the time they got to the ward. Now, if someone had scribbled that on a bit of paper, it's not always going to do the job. So there was a lot of repeat testing, which also then slows down the movement of patients because they needed to confirm before they could let them through the door. With pregnancy test, it's not unusual for women to require that before X-ray. They might do the pregnancy test in emergency room. They get to X-ray, the results on in the records to be able to determine that. So they're just languishing. Well, shouldn't say languishing in corridors, but it introduces delays. It introduces delays that needn't be there for the sake of something that's effectively an admin piece of admin. So these digital solutions remove that. The other thing about this is, I think what you need for something to work, it needs to be simple, it needs to be accessible, and it needs to be scalable. And by simple, I mean uncomplicated. People know how to use mobile phones. We're not asking them to learn a new skill in doing this. So by having it hosted on mobile phones, there's an amount of inherent knowledge that they have, an amount of intuitive approach that they have to it. And it's accessible because it's low cost. We can, add phones without having to, spend a huge amount of money to create a whole new infrastructure or even create connections each time. And those phones don't have to just be in the hospital, as Raul said, they can be in community settings. It's still integrated into the hospital record. So the accessibility is there. And finally, in terms of being scalable, we can add tests to it. And it's not another thing that they have to learn to do. It's not like, okay, every test, here's an analyzer. Okay, now we've got another test, here's another analyzer. We're not just lining up machines on a benchtop. You know, it's the same machine, it's the same general flow. So we're not having to retrain them. Their competency comes along with them. So it's much quicker and easier to implement that new testing because they already know how to do it.
No, 100%. So go ahead.
I just want to jump in because Rahul made a really good point around community, sort of like professional use at home testing. You know, Andrew and I and TestCard have been fortunate enough to be working with Yorkshire Cancer Research on a bladder cancer trial, which is quite elderly people at home with phones doing testing. And I have to tell you, I had some questions in my mind about whether they were going to feel comfortable about using technology for their healthcare. They took to it like a duck to water. They're testing themselves. They don't get the result themselves. It's sent through to that clinical professional who reviews it. And what that means is that we're talking about filtering and screening, right? Funneling down the people who really do need to be using the time of those specialists, you know, if they are ill, and then allowing other people not to have to travel in to their GP for every little thing. So the extensive benefits that you can see from moving some of that early screening out of laboratories and out of GP surgeries and allowing people to test themselves at home. It also makes people more proactive and more invested in their own healthcare, and reduces pressure on the NHS.
Okay. No, thank you for that. What I was reading whilst you were talking through that, and it comes back to a little bit around the smartphones and I guess the integration with them, and that actually leads us quite nicely onto one of the questions that's come in. And please, whoever feels it's necessary to answer, jump in or whatever works best. One of the questions is, does it work with any smartphone? And then does the UTI kit integrate with pharmacies and GP records?
I'll take the first one. Well, I could take both actually. So the clear screen solution, which is what we're talking about, what's used in the hospital, is currently on the Android platform. We have iOS in the pipeline. So yes, and it also works on other smart devices. So we're working, for example, with Roche Diagnostics. They have a new glucose meter called the Cobas Pulse, and we're developing an app for that product as well. But for TestCard's at-home testing, self-testing, it is available for iOS and Android, and can be downloaded from the app or the Play Store. And yes, we are integrated with pharmacies. So if you receive a positive test result, you can access a pharmacy and get treatment within a day. So very straightforward and convenient way to UTI is quite a painful, unpleasant condition. So the faster you can get it sorted, the better, really. So
one of the other problems I think we tried to solve when we made TestCard is digital health has got a lot of opportunities. It's amazing that it has a whole suite of tools, and there's thousands of apps out there, that literally probably hundreds of thousands, that do amazing things, but they don't all fit together very well. And a lot of this creates difficulty in terms of capacity and cost in terms of time and effort to bring them to get them to work together. So we wanted to make a system that was, you know, we created low touch integration options, which means that we can very quickly integrate with new partners without a lot of cost or weight on them in terms of spending time doing all the IT infrastructure to put it in place. So we create these digital referrals, which means that within around 2 weeks, a new provider can have a test and treat service. So they can provide a test card, and then having done the test within their home, they can directly access treatment immediately. Because, you know, some of the barriers to healthcare aren't about physical barriers. They're not about the fact that they can't get the thing. They're about the fact that they don't do the right thing at the right time. They don't want to have to take time off work. They don't want to have to admit there's something wrong. So if we just provided an answer saying, oh yeah, you've got a UTI, best of luck, it's not ensuring that we're improving any sort of process. So we knew that we were going to have to create a system that allowed them to immediately access treatment in the most easy and accessible way for them, because that is the right next step for them. So to lay it out in front of them straight away, it gives them that option, so they can still access it through GPs, they can access it through community pharmacies, or if they're purchasing it through high street retail pharmacies such as Superdrug, for example, they can access treatment privately directly through them.
Okay, perfect. No, thank you both for that. The second question, Andrew, this might come to you to answer here, but again, either way, with current trends in lateral flow development being related to amplification techniques, will the extra steps required be acceptable for home use, or will it be best used in clinical settings?
It's a good question. It really depends on the amplification techniques and how that's reporting out.
Yeah.
So the way that our technology works, it's effectively, it still needs to read a visual reporter.
Yeah.
So we need to be able to see a band. Now, we do know that our reading technology is more sensitive than the human eye. We are able to see bands that the human eye aren't able to see. So we do have the opportunity to become more sensitive. But some of these technologies require that you are they're fluorescent technology,
Yeah.
for example, in which case it's not something we're going to be able to do
Okay.
as things stand on mobile phones.
Okay.
But there's a lot of opportunities to be using. I mean, I think the difficulty for us is not finding the test that we can do.
Yeah.
It's deciding on which test to do.
Okay.
There are so many readily available, really good rapid diagnostic lateral flow tests out there that will help both in the clinical environment and in the home environment.
Yeah.
And for us, it's about finding the right clinical utility and opportunity and the right people to work with to develop or deliver that particular product.
Yeah.
You know, the opportunities are already there.
Yeah.
We don't need, I mean, we're effectively taking existing technology and making it better, making it more reproducible, make it more standardized, make it more deliverable. We don't need the newer technologies. That's where the labs really come into their own, is taking those new things and delivering them in specific circumstances in clinical settings that are really going to make the difference to them.
Yeah, I think as well, I just want to really point out what's kind of been a theme throughout is that collaboration piece between yourselves and other companies like Dr. Rahul and guys in St. Tom's. If anybody watching and anybody who is listening to this afterwards or before wants to open up that line of communication, then please obviously reach out to the TestCard team as well. I'm sure they'll be more than happy to speak with you. We've only got a couple of minutes left, so I want to go round each of you and just make sure you don't have any other points you want to cover, or if there's any kind of things you think we've missed off. Catherine, and I'll start with yourself.
Oh, sure. Put me on the spot. No, I think, you know, Rahul and Andrew have really said a lot of what I would have said. I think what the last point Andrew just made around figuring out what opportunities work best with our version of things. Because of course you're always going to have, you know, very, very high end, very, very cutting edge testing. When that then starts to become more available on the high street, for lack of a better term, because our solution is low cost and is highly scalable. You know, what we want is to be using the best quality. So like at the moment, lateral flow tests and urine, we do colorimetry urine dip tests as well. Just in case anybody's interested in touch. Sell. So that is the best cost-effective sort of rapid diagnostic test available. Eventually they will make molecular tests like at the bedside, super cheap, and we'll be reading those. You know, at the moment that is a sort of more lab focused thing. So it's always about looking forward and thinking about where we want to be positioned, making sure we have the highest quality that we're working with. You know, it's why we're very fortunate to work with SureScreen, because they do make very high quality tests. Their tests do what they say they're supposed to do in the instructions for use. It says it should do this, and it does. So we need to make sure, because it's important to our clients, obviously, that the tests are of the best quality.
Okay. I do actually just one question that came in, and I'm probably going to direct it your way, just judging that I think you'd be the best person to answer.
Well, let's find out.
Are there any IP constraints for the freedom of use outside of the NHS?
So Andrew would be the best person to answer it, but
I was wrong.
So we do have freedom to operate. We have a number of different patents on both the design and the utility of our testing to allow us to be able to do what we do effectively. And that freedom to operate has been investigated now by a number of different people. We work very closely with Roche Diagnostics on a couple of projects, both in research, and also we're going to be one of the first apps on their new glucometers in hospitals, which is a Cobas Pulse. So the clear screen app that we worked with very closely with Guy's and Thomas's, that application will be going on the Cobas Pulse.
Oh, wow.
So obviously Roche want to know that we have that freedom to operate. So we have had a very thorough inspection to ensure
that.
that we're allowed to do the things that we're already doing.
Perfect. No, thank you. And whilst I'm with you, Andrew, is there any other points that you want to kind of cover before we end? We've got a couple of minutes left, but feel
I
free.
don't think so. I think what I suppose one thing I'd like to say is, as someone who started a small company in health, there are a lot of small companies in health out there that can make a lot of difference.
Yeah.
I think it's very difficult at times because our voices are very small and we can't shout very loud. We can't get the penetration into the different services or see the right people. So I would say, you know, if you do see these things, they're making the difference to saying yes to these different solutions that can make a difference to patients really makes a difference to these small companies, because they've got so little time, so little capacity. It's working with people like Raoul makes a difference between these products, which can make a genuine difference to patients actually coming to market or just disappearing. So yeah.
No, perfect. Thank you. And Dr. Rahul, look, thank you for joining us. And obviously, lastly, I'll end with yourself and your kind of overview there.
Yeah. So I think what I'd like to say is that, look, it's been a great experience working with our partners here at TestCard and SureScreen. But what I would say overall is that implementation in the NHS is difficult. And I think the most important thing is don't give up. You know what you want to achieve. You know that it's going to be difficult. Find good partners, and don't necessarily find, you know, the biggest partner. Like Andrew said, there's a lot of smaller companies that have great technology that are looking, you know, just need a little bit of insight and input. And those are the partners that you can really help along. They can also solve the problems that you need solved, you know, and those solutions then go from a local solution to a national solution. So I think if I had to say anything, it's just, you know what you need to do, and you know it's very difficult, but it's well worth the journey.
Perfect. I think that summarizes it perfectly, and a great way to end. All three of you, thank you for taking the time and really going into some really good detail there. Hopefully that's given everybody listening and listening back the opportunity to get an insight into this kind of partnership, TestCard, and what you're doing at Guy's and St. Tom's, Dr. Rahul. We will do our best to answer any questions that haven't been answered today in the follow-up document after the event. And if you do want to receive that event, if you're listening on LinkedIn Live, then please feel free to sign up and you'll get a recording of the event. You'll get some clips and any questions. But look, thank you all for joining us, and
thank you, Nathan.
really
Thanks for
appreciate your
joining
time.
us.
Thank you.